Let's talk about how policy and patient outcomes go hand in hand. I'm Dr. Eva Amwai, a regulatory affairs pharmacist working in the sub-Saharan region of Africa. Sometimes we feel policy is very distant. We say, we have to read all these pages. It's very technical. Sometimes it's very removed from the common mwananchi, from the common person. But my experience tells me otherwise. The truth is that policy shapes what care people can access and how much you pay a product for, how much available a product is, and all of this comes under a policy. Now, policy is just not paperwork. You've seen all the videos I've done about working in policy. You've seen me in conferences. You've seen me in meetings where we are talking about a certain framework, right? Policy is just not those meetings and those frameworks. It's just not the boardroom meetings and government offices. It actually is what happens in the clinics, in the hospitals, in the pharmacies, what reimbursement systems they are, and whatever treatment outcomes we expect for our patients. That is what policy is. So when policy fails, patient outcomes fail, and patients pay the price. So you and me pay the price for when the policy fails. If a country has weak medicine regulation, patients are exposed to poor quality products. They are also exposed to essential products being out of stock. They are also exposed to self-care policies being ignored, and most of all, an overstretched healthcare system that carries even more pressure as more people get the healthcare access to healthcare. If prevention is underfunded, and I know prevention is mainly also vaccination, right, in our setting, and if we feel that vaccines are not available, or they are substandard, or we have to pay for it now. Those of you who are moms like me know that vaccination is very important for your child. Imagine going to a hospital and being told, come back next week. Again, you come back, it's not come back after 2 months. Your baby is still growing. They've missed the milestone of getting the vaccine, but you have no other choice but to wait. That is what policy can do if policy is not strong enough, and if policy is not centered around the patient. If access pathways are slow, patients wait longer. And how many of you have gone to a national hospital or to a government hospital and said the lines are just too long? I cannot wait. So that is also patient outcomes. So when we talk about health policy, we are really talking about people at the end of the day. And the mother looking for the treatment for the child, the patient managing a chronic condition like diabetes, heart disease, any viral infection, a healthcare worker trying to provide care in a constrained system, right? Nurses will go on strike, pharmacists will go on strike, medical doctors will go on strike because they are feeling the system is constrained, right? The family making impossible decisions. Maybe let's take our loved one out of this hospital into a private one, or fly them out of the country to get better healthcare just because the taxes they are paying are not funding the policy. So policies create better outcomes if we think about it, and if they are made to be patient-centric. And working in regulatory affairs has taught me strong policy can create better health outcomes, as in studies have proven it. So it's on period, like outcomes when it's practical and evidence-based and grounded in the realities of a country, the policy will work, right? And this matters a lot in Africa, where our health systems are diverse and where health is very significant, and where policy choices most often stretched and limited. Good policy must be context aware. You cannot simply just copy and paste a policy from another country. And that's why sometimes it takes long for us to make these policies and for us to contextualize it, because we see another country has a nice policy and we think, we'll come and copy paste it. But no, When we are coming up with a patient-centric policy, we ask ourselves these questions. Will it improve access? Tick. Will this support quality? Tick, tick. Will this reduce inequity? Tick, tick, tick. Will this system strengthen over time, and is it sustainable? Tick. Will this make healthcare more responsive to real needs? Yes. And if these things are ticked and these things are considered, we know that when is the true measure of policy. Because at the end of the day, policy success should not only be measured by the type of policy that is there, but the change it brings to the patients. When policy is done well, patients feel the difference, right? So, what healthcare issue are you feeling right now? What healthcare policy affects your community right now? Comment below and let me know. Let's interact in the comment section. Thank you.